Hi everybody, it's Dr. Cary Yurkiw. Thank you for joining me today for this live webinar. And we're going to be talking about why you feel sore after a chiropractic treatment or adjustment. This is a very common question that I get in the clinic as well as here on social media and YouTube. So why do you feel sore? I'm going to switch over to my slides here and just so you guys can see what I'm talking about today. So my name is Dr. Cary Yurkiw, and I'm a chiropractor who practices in Kelowna, British Columbia. And I have over 25 years of experience. I am accepting new patients. Usually I can see a new patient within 24 to 48 hours. So why do you feel sore? Well, you can feel sore because of muscles and ligaments that are changing after the adjustment. So when we do adjustments, there's muscles and ligaments between the bones, and I'm going to put this slide up for you. So when we're realigning the spine, the muscles on one side have to stretch and the other side they have to shorten. And this is to adapt to the new alignment of the spinal bones. So everything revolves around that core, and that core is the spine and the discs. So when we do adjustments, there's an adaptation or a compensation or recompensation happening around the spine, and the muscles and soft tissues are getting used to the bones being in a different place. Also, between the bones, there's ligaments. So here's a cross section of the spine, and what you see here is the disc. There's the bone right there. And then you get these ligaments connecting the tissue together, like right here, the anterior longitudinal ligament, ALL. And then you have the posterior longitudinal ligament, PLL. And then what you have is ligaments like ligamentum flavum, interspinous ligaments, intervertebral foramen, where the nerves come out, and then the supraspinous ligament right here. So you have tissues that are connecting the bones together, and these ligaments also have to adapt. Some of them stretch, some of them contract, and this is to get used to the new position of the vertebrae. So I'm just going to minimize my screen here, just bear with me. And then the last thing is inflammation. So what happens is before the adjustment and then after the adjustment, there's inflammation present in the spine. So that inflammation is there because it's the healing process happening in that area. So if a bone's out of place or you just had an injury, there's swelling, soreness in that area. When the chiropractor touches it, it could be more sore, and they do the adjustment, it could increase the inflammation and the swelling temporarily. And that can actually be more tender to the touch, but it's beneficial because the inflammation has nutrients in it to help promote the healing process. So there's the body's producing certain chemicals to help the healing process and to regenerate the tissue. So it's actually a good thing, but temporarily feels sore. So what can you do about this? Number one, you can put ice on that sore area. I recommend 10 minutes of ice, and then I tell my patients to repeat that for 3 to 5 times. So talk to your health professional before you do anything new. But generally, this is the recommendation I give patients that have just had an injury, have a bone out of place, it's very sore. We do an adjustment, it could be more sore temporarily. So I tell them put ice on it just to reduce the swelling. Do that for 3 to 5 times, and then rest the area. So just let it rest so that it can heal and heal a little bit quicker. You want to let your chiropractor know because they're going to want to document that. They're going to want to tweak your treatment plan because they want you to feel better, and they want you to feel better in the shortest period of time. So your chiropractor is going to work with you, giving you the right types of treatments and the right type of advice for your condition. If you're interested in coming to the clinic, here's my contact information. My email, drcaryyurkiw@gmail.com. If you have any questions, feel free to type them in the comments, or you can send me a DM. I'd be happy to answer those. My website, drcaryyurkiw.com. Phone number 250-486-0062. And on social media, we're at Dr. Cary Yurkiw. That's Facebook, Instagram, Twitter, and TikTok. So you can reach me there, and I'd be happy to answer your questions. If you do want to come in the clinic, you can go to the website or call this number. You can also send us a text or a DM, and I'd be happy to respond to that and get back to you. And we do these live videos on Monday, Wednesday, Friday. So please join me again here on YouTube Live and on social media. I've been doing a lot of live videos here on Instagram, but also switching it up a little bit to other platforms like Facebook. We did a Facebook Live this week. We also will do Twitter Live. So please follow me on the social media platforms, as well as subscribe to this YouTube channel and our podcast channel called Super Healthy. It's on Spotify, it's on Google, and it's on Apple. So subscribe to those channels, and then I'll talk to you guys again on Monday. Have a wonderful weekend. If you have any questions, please DM me. Be happy to help you.